So this is part two. So if you missed part one, I put the YouTube link for our YouTube channel for the city's wellness resources in the chat. Feel free to go back and check that out. It has been a little while. Today we're talking about functional motility disorders. So just as a recap, last time we talked about structural issues, and we'll talk about the difference of those between those in a little bit, but um, today's more of a focus on functional issues. So we're going to talk a bit about the microbiota because that impacts how our gut functions, and we'll kind of talk about what that is. Acid reflux or GERD, constipation, diarrhea, bloating, flatulence or gas, small intestinal bacteria overgrowth or SIBO, irritable bowel syndrome, and leaky gut. So these are hopefully some terms you all have heard before, but we'll kind of take a deep dive and explain some of these. So as always, we need to kind of review what our gut looks like to begin with. So we eat food, it goes in our mouth, it goes down our esophagus over here. There's different spellings of that. So OE, I think it's more of the British way. You have your stomach, it goes, and your stomach's really acidic. Again, digestion really starts in our mouth. We have those salivary glands that help us digest some of those carbohydrates. The stomach's going to continue to break down. A lot of protein digestion happens there. Goes through a tight ring of muscles called the sphincter and between the esophagus and the stomach to get there, which is going to be important when we talk about acid reflux. And just as a refresher, the stomach is very acidic. It really helps with preventing diseases, somewhere between 1.5 and 3.5. So slightly less acidic than battery acid. So when acid gets from your stomach into your esophagus, it's not going to feel great because the esophagus wasn't made to handle that. After food goes through the stomach, it goes into the small intestine, which is about 23 feet long with all of this little winding and swerving around. And that's going to do a lot of our absorption for nutrients. Just again, this is what that intestinal line looks like. We talked about this. We'll talk about it a little bit more later. But we have these tiny little finger-like projection. Those nutrients get absorbed. Nutrient absorption happens along those finger-like projections. It really helps as far as protecting. Again, you have like this mucus layer that's on top of it that helps keep us from getting sick too, because it's binding up some of those pathogens and bad bacteria. And you have really, really tight junction cells. So each one of these little cells here this is one cell, this is the next cell. So they're really close and kind of smushed together. We'll talk about that a little bit more with leaky gut. So we'll come back to that. And then our friend, the pancreas for the small intestine is going to help us out with some stuff to help break down food and help with absorption. It also helps with managing our blood sugars when food gets absorbed. And then it goes into the colon, which has four main functions. It helps with water reabsorption, nutrients for vitamin B12 and K specifically. It has the home to our wonderful microbiota, which we'll talk about in just a second. But they actually have some vitamin K production in themselves. And this is kind of how nutrients themselves are absorbed along the digestive tract. So mouth and esophagus, alcohol is getting absorbed in the stomach. You have all of these nutrients along the small intestine, which is where most of nutrient absorption happens, and then some in the colon, like our electrolytes and our water. A lot of stuff does have to go to the liver to be processed before it goes to the heart and in the bloodstream. A lot of sciencey stuff to kind of go over, but it will help explain some of why functional disorders happen. So we get into the gut microbiome. So we have our colon, and our friend the colon is where all of the gut microbiome is typically. Primarily there, it includes bacteria, fungi, yeasts, archaea, and protozoa. So a lot of little different cells and things like that. Each person has their own microbiota. So it's kind of like a fingerprint. Each person's fingerprint's different. Each person's microbiota is a little bit different, but there are some commonalities based on your age, genetics, the environment in which you live. It's linked to different immune functions, metabolism, autoimmune diseases, and mental health and brain health. So maybe you've already heard about the microbiome, maybe not. Hopefully this will help make it make a little bit more sense, but there are all of these little bugs in your colon that live there and give us some health benefits. Some of these health benefits include providing fuel for the gut lining, helping get things going in the large intestine as far as just keep things moving so you're not constipated, balancing out our blood sugars. It triggers the intestine to make glucose, telling our brains that we're full, stimulates the immune system, release of gut hormones, and directly affects our fat tissue, liver, and brain. It's been linked to certain chronic diseases as well. So there's a link between what our microbiome looks like and chronic conditions we're at risk for. But a lot of this comes not from the microbiota themselves, they're living there, but when they eat the good healthy food that we eat, they break it down and they produce short chain fatty acids, acetate, butyrate, and propionate, that give us that benefit. Which a lot of you might be thinking, well, why don't I just eat those short chain fatty acids? Well, when they get produced in the colon, you get more benefit. It might not make it all the way down to the colon to kind of go along the gut-brain axis. But here's our gut-brain axis. So it is the flow of information between the brain to the gut and the gut to the brain. So it goes both ways. It goes along the enteric nervous system. So you can kind of see this bidirectional flow. It regulates and synchronizes our gut functions, regulates digestive processes, modulates our gut immune system. So 70% of your immune system lies within your digestive tract. Really important to help you stay healthy. And it helps coordinate physical and emotional state within the GI tract. So the way I like to think about this is if you've ever been in an event where you're nervous, you get butterflies in your stomach. There's that saying. You feel it in your gut. If you're stressed out, a lot of times we feel it in our gut. And for some of us, that becomes a lot more severe than others. And same way, if your gut is sick, it can actually impact your mental health and how you think and feel and process about things. So there is a link between them. So on the left side here, we have our stable mental state. Right side, chronic stress, depression, anxiety. And which came first, the chicken or the egg? Kind of depends. We don't really know. Might depend on the person. So in a stable state, you should have a functional gut microbiota, intact gastrointestinal lining. So those lovely little finger-like projections are stable and close together. Controlled inflammation, gastrointestinal comfort, everything's flowing right. You're not having any issues. You're having normal bowel movements. Nothing's going crazy. I will warn you, we are going to be talking a good bit about poop today. So I'm sorry if it gets gross. With chronic stress, depression, anxiety, that bacteria in your gut, the microbiome's kind of messed up. You have increased permeability. So those cells that are close together kind of separate some. It's easier for stuff to get through, which means immune activation. Your gut might be more sensitive to certain things. You might have more pain, bloating, discomfort, and altered motility. So you might have diarrhea, you might have constipation. Kind of depends on the person. These are all different things that can impact your gut microbiome. So if you're breastfed or formula fed, that's going to impact it. Exercise, smoking, drinking, alcohol, hygiene, hand hygiene. How well do you have hand hygiene? Where you live in the world. If you're somebody who grew up in the plains of Africa, it's going to be very different than somebody who lives in Dayton, Ohio versus like New York or LA or China. How old you are, that aging process can impact your gut microbiome, how your food was produced, diet, what medications you take, different conditions you might have. Again, if you live in a city or a rural area, how you sleep, pets, if you're born as a C-section versus vaginal birth, those are all going to impact what your gut microbiome looks like. But there are some links between how certain people's gut microbiome looks like marathon runners have more of a specific bacteria. So that kind of ties in real quick before we even get into some of these disorders too, is like probiotics and prebiotics. Reason being, probiotics are those bacteria and those like different organisms in your gut. When you eat probiotics, it adds more good bacteria to that microbiome. It's thought to help and promote anti-inflammation, help with the intestine's immune function, helps with that mucus barrier, which you'll see in a little bit here. But prebiotics are basically the food for that bacteria. A lot of these are fiber, and we're going to talk about a lot of them later, specifically with IBS. But fructooligosaccharides, galactooligosaccharides, xylooligosaccharides, isomaltase, maltose, inulin. And then those are all the fibers, and then maybe some polyphenols, which are chemicals in plants. Maybe some polyunsaturated fatty acids get consumed by these bacteria. So the thing with that is, though, whenever you have bacteria consuming things, there's fermentation. So we're going to keep that in mind. Kind of like when you ferment beer, there is gas produced. So backtracking, we are looking at functional disorders today. Structural disorders being more like that building structure. If there's something wrong within the building's going to fall apart. Functional disorders, or you might have a flat tire and or a pencil without lead. There's something functionally wrong. You might not have a nail in the tire. You just might be cold outside and you're losing air, whatever. But there's something wrong. Your tire's flat. All right. So when we're looking at functional and motility disorders, 1 in 4 people in the United States has a functional or motility disorder. 40% of the GI problems are functional motility disorders. It includes disorders of that gut-brain axis, like we talked about. Also includes motility disorders, if visceral hypersensitivity. So basically, your gut is just extra sensitive for whatever reason. It's a little bit more able to be irritated. Altered mucosal and immune function, altered gut microbiome, or altered nervous system. So your nervous system's just not working the way it should. With that, functional disorders, you want to make sure that you see, like we talked about last time, if there's a structural issue first. If there's a nail in the tire, you need to fix the nail in the tire. No matter how much air you pump in the tire, you're still going to be losing air. So it's important to diagnose that and make sure that that is excluded. So we get into some of these issues. So GERD and acid reflux is technically a functional issue. So if you look at the stomach, you have this tight ring of muscles like we talked about earlier. And normally you have atmospheric pressure that's greater in the esophagus than the stomach. So a little physics here. If you remember thinking back to high school, pressure goes from higher to lower concentration. So if it's higher up here, it's going to go down here. If it's higher down here, it's going to go up. What happens with that, a lot of times with acid reflux or GERD, your pressure becomes greater in the stomach. So your acid's going to flow up through the esophagus. And that's tight ring of muscle is there to help prevent that acid from going up, but either it's not functioning properly or there's just so much pressure here that it's going to allow that acid to go up into the esophagus. So it's technically diagnosed when you have it more frequently, at least twice a week, as gastroesophageal reflux disease. Acid reflux is more on that occasion, not as often. It's normal to have acid reflux on occasion. Certain conditions will impact acid reflux. Pregnancy is one of them. If you need to lose weight, if you have more weight around that midsection, it's going to create more acid reflux because you have more pressure pushing in that stomach. You might have a feeling of burning sensation, a lump in your throat, chest pain, especially when you're laying down at night. It tends to be worse for a lot of people at night. You might have excessive belching or coughing within an hour of eating too. So different risk factors: overweight, obesity, pregnancy, hiatal hernia. So if you have a bulge at the top of your stomach into the diaphragm, that's going to create, again, that pressure difference. Changes in anatomy, normal relaxations of the sphincter. So treatment, usually you're trying to decrease that stomach pressure and increase the amount of pressure in the esophagus. You can try to decrease how acidic the stomach is. So that's going to more so help treat, but not necessarily cure it. And then improving the clearing of contents. So helping gravity kind of keep working and make sure that foods are not irritating the esophagus. So this includes tobacco. Tobacco is nicotine itself is going to alter that pressure, and it also increase that acid in the stomach. So eating small frequent meals, if you have a lot of food in the stomach at once, it's going to increase how much pressure is in that stomach. Caffeine and alcohol intake, that'll increase the pressure difference in the stomach versus the esophagus. Certain positions, so if you think when you bend, you lay down, you lean over, that's going to change where things are and just create more pressure on that stomach, so creating more likelihood of acid reflux. maintaining a healthy weight, learning healthy ways to manage stress. So especially deep breathing exercises, that helps strengthen that ring of muscles on above your stomach, so that sphincter, and helps them work more properly. So good stress management, and especially like those deep breathing exercises, can really help strengthen that sphincter and help you manage your acid reflux better if you're having issues with that. Lean protein, for whatever reason, helps change that, decrease the pressure in the stomach. And high fiber foods can help make you feel more full so that you're not eating as much too. Fluid between your meals, because if you have them at your meals, again, it's just contributing to that volume. So you have more volume in the stomach. It's going to increase the amount of pressure so that it's more likely to have pressure going up. And then certain foods. So high fat foods, chocolate, spearmint, and peppermint tend to be ones that can increase acid reflux as well. To decrease the acidity, certain foods cause more stomach acid. So alcohol, caffeinated and decaf, coffee and tea. Coffee and tea have methyltrexates that they increase the acidity of your stomach acid. Pepper, for whatever reason, and then calcium in large amounts. So like Tums, those little Tum tablets have calcium in them. But if you start taking a lot of those, you get what's called like an acid rebound. So your stomach starts producing more acid in response to that. Some medications you need to be careful of too. So like your ibuprofen, NSAIDs, those kinds of medications can increase acidity. And then certain foods that irritate the esophagus tend to be citrus products, other acidic foods, vinegars, some spices. The big thing with that too is like if you chew food, saliva that your mouth produces, the other thing nicotine's going to do is reduce the saliva. Saliva helps neutralize the acid of your stomach. So if you can produce more saliva down your mouth, it is going to help neutralize that acid. Chewing gum, hard candies, lozenges, sugar-free lozenges, those will help your mouth produce more saliva and mucus so that it's not having issues. So this is a summary of the food recommendations for acid reflux. And I'm apologizing right now. We're going through things pretty quickly just because there's a lot of different conditions here. So if you have any questions, please reach out to me. I'm happy to kind of go more in depth on these with you too. Again, antacids neutralize the acid in your stomach. They can help treat but not prevent GERD. You do want to be careful of them because if you're taking them constantly and you're eating a lot, it can create that rebound. Proton pump inhibitors, they block the site of acid production. So again, it's helping treat because you're not producing as much acid, but it's not ultimately going to fix the problem. And then worsening symptoms, many pain relievers, again, the NSAIDs, like ibuprofen, Aleve, they irritate the lining of the stomach and esophagus. So just talk to your provider, work with them. And then long-term medication use for GERD can actually decrease how much calcium is absorbed in your body, as well as iron and B12. So you might kind of get those checked out too if you're having long-term issues. And then functional constipation. So going on. So functional constipations could be a physical problem or it could be a structural. So it can be one of these three things. You have slow transit through the GI tract. So it's just your poop's not moving very quick. It's taking a long time to move through. As it takes longer to move through, more water is getting reabsorbed in your colon, leading to hard, dry poop. It can be an evacuation disorder. So sometimes like the muscles that help your gut contract to move things down might not be working quite right. So you might not have that good final push to help coordinate those bowel movements, which can be from uncoordinated bowel movements itself. If you've practiced holding it too much or have problems with toileting habits, or it could be a physical or structural problem. So again, good to get it checked out. If you've had issues, just to make sure, kind of rule out anything more serious. Or it could be IBS, which is a constipational predominant IBS, which again, we're going to talk about IBS a little bit later. Causes can be from low levels of activity, so you're not staying physically active. It could be from stress. It can be anxiety, depression, that mental side of things. Pregnancy, change in hormones changes things. Changes in routine, ignoring the urge to go, not eating enough fiber, if you grew up having toileting habits. History of physical or psychological abuse. So trauma can affect the function of the muscles involved in the gut too, just again, that gut brain axis, or it could be because of certain medications or supplements. Different medications can impact the bowels directly. Big one, if you've ever been on opioids, opioid relates to constipation pretty frequently. So if you those more intense pain meds, a lot of times after surgery can be really problematic because you're on the opioid because of the surgery and you're not moving as much. Functional constipation treatment, making sure you're drinking at least 50 ounces of fluid a day, at least. That'd be probably on the very low end. And 30 grams of fiber is recommended for everyone. Exercising at least 3 times per week, trying to have good toileting habits, allowing yourself time, trying to go to the same at the same time every single day, and giving yourself 5 to 10 minutes just to relax. It'll help those muscles relax so that you're having an easier time going. Different times of the day, you're more likely to have a movement. So like in the morning, especially after coffee, it helps speed things up. You could also try 6 prunes or a kiwi. Oddly enough, it works. They are helpful for constipation a lot of times. Psyllium husk is a type of fiber that is helpful for diarrhea, which we'll see in a second, but also flaxseed helps with constipation as well. Psyllium husk will help with constipation. And then certain probiotics might help, which we'll look at. And then worst comes to worst, certain meds, there are laxatives that you can take to help with constipation. There is a proper way to poop. And it looks like this. If you've never seen the little squatty potty little stools, they have them. But you are supposed to sit at an angle because there is a kink in your colon that if you sit with your knees going straight out, it's going to stay there. This allows that kink to open up so that you can go more easily. So making sure your knees are slightly higher than your hips, leaning forward, propping your elbows up, trying to make yourself kind of wide, your spine straight, broadening at the waist, and relax and lowering your shoulders. So good toileting habits, good things to think about. Most toilets are not actually conducive to proper bathroom use. Moving on to functional diarrhea. So every day for the normal person, around 300 ounces of fluid enters the small intestine, and about 90% of that is supposed to be reabsorbed. So 90% of that's supposed to go back into the body. With functional diarrhea, that's not happening. I mean, that's a lot of fluid. If that's not all getting reabsorbed, it's got to go out some way. So there's three different types, just like constipation. There's acute, which more like traveler's diarrhea. If you travel and you tend to get diarrhea, that's a big one. Antibiotic associated. So if you've been on an antibiotic and have had diarrhea after being on the antibiotic, it causes changes in that gut microbiome leading to diarrhea. About 30% of people have looser poops when taking antibiotics. And there are treatments with specific probiotics to kind of help with that too. And then there's chronic functional diarrhea, which is more what we're going to be looking at because it's not as short term. It's a functional disorder. Can be related to a structural issue as well with irritable bowel disease, celiac, etc. So those, again, can be more severe, so good to get checked out. Treatment though, smaller, more frequent meals, limiting the foods that stimulate the colon. There are certain foods that are going to cause more problems, like chili peppers. High fat meals are going to cause more problems, coffee, alcohol. Low FODMAP. So FODMAP is going to be what we're talking about with IBS, but it is fermentable oligosaccharides, disaccharides, mannitols, and polyols. Go over that again. But these are foods that are more fermentable by the microbiota and will cause more GI issues. So if you're having severe diarrhea, though, you might consider trying to add in electrolytes like Pedialyte to help. Pedialyte's a little bit lower in carbs than Gatorade, so usually why it gets recommended too, and it has more electrolytes, but that can help with rehydrating. Psyllium husk, again, works for constipation, works for diarrhea. It helps bind up stool so that you're not having as much diarrhea. Avoiding nicotine. Nicotine, again, stimulates the gut. And daily pelvic floor exercises can help as well, which, again, we'll look at that. Some meds, there are anti-diarrheal medications like Imodium. Your pelvic floor can be associated with constipation or diarrhea. You have some muscles, this obviously is a girl, but you have some muscles around all of the organs in the lower part, kind of in that pelvis region of your abdomen. These, there's several layers of them, front, back, sides, in the middle. They help keep everything in place. And if they're weak, things are not going to be working the way they should. If they're too tight, things are not going to be working the way they should. They help control urination and bowel function and maintain continence. So if you have any issues with stuff like that, like if you tend to have issues with leakage or incontinence, this might be something to look into. You can check out, I'll send out the slides for this, but there's links to National Health Services in Great Britain and the Mayo Clinic, just for more information on the pelvic floor. You can also talk to your provider because there are pelvic floor physical therapists that can help with strengthening these muscles. Or again, if you're too tight, you might have issues with constipation. So it could be urinary incontinence and other issues, but these muscles are going to help keep everything synced the way they should be. It's going to help keep things from flowing when they shouldn't be. So another good resource too to just kind of check out on that. Functional bloating. So this is again, if you're thinking about your abdomen kind of like a balloon, if you inflate the balloon and you feel like you're really floating up, that's going to be bloating. You just feel like you got your balloon expanded too much. There's a large volume of food or fluid consumed can lead to bloating. Gas produced from the microbiota, from those more fermentable foods. Heightened sensitivity of the intestines can cause some bloating. Your reflux between the diaphragm and the belly. So as you breathe, the diaphragm is supposed to come up and down. So it might not be synced quite right. Bloating, again, 3 different types. There's continuous, intermittent, and normal bloating. So normal bloating is going to be our normal everyday bloating. Some bloating is normal. Continuous bloating could be a reflex, as far as like it could present with no fluctuations or associated with food. It could seem separate from that. It could be another issue. Intermittent tends to be more normal towards the end of the day. You feel the worst. That's where the bloating is not consistent throughout the day. Treatment. Once triggers are managed, that bloating typically resolves. So it's normal to have no bloating after you treat everything. First things first is to try to avoid large meals. Make sure that you're taking your time to chew. If you chew too quickly, now your stomach has to do the work that your teeth were supposed to do. So good to take the time to chew. It's going to be smaller amounts that the bacteria can't ferment as much. Avoid swallowing excess air. Avoid polyols. Those are going to be xanthol, maltitol. If you look at sugars on the back, if it ends in "all," it's probably a polyol. Sorbitol is another one. Don't overdo fermented foods. Limit fruit to 1 piece per serving because it has a lot of fructose. So fructose in large amounts can cause issues of bloating for some people. And try to choose whole foods instead of smoothies and juices because, again, that fructose is going to be more concentrated in those smoothies and juices. You're taking out a bunch of other stuff to help not have so concentrated. And then also, if that's not working, you can try checking for different food intolerances. We're going to be talking about food intolerances a little later as well. You could have the portions of those highly fermentable foods if avoiding certain ones wasn't working too well for you. And you can consider other gut-brain axis strategies. So sleep is a big one, stress, exercise. You could try yoga. Yoga really helps with this. Good bowel and toileting habits, again, strengthening that pelvic floor, and bowel massages can help. And if you're having issues, keep talking to your provider about it. There could be some other things that you could do. Small intestinal bacteria overgrowth is one we're going to be talking about, but um, lifestyle things to help with bloating. Avoid tight clothing that's going to push on that stomach and just make you feel more bloated. Gentle exercise and stretching can help diffuse some of that trapped gas as you move. That gas will just kind of move its way out. Going for a walk to help deflate. Peppermint oil capsules can help as well. They can relax the gut muscles and help relieve some of that trapped gas as well. You could try a heat pack. Warm or damp towel can help loosen some of the gut muscles. Again, releasing some of that trapped gas so that it can settle some of the gut muscles. If you're having a lot of gas, so different from bloating, the gas is trapped. If you're having a lot of gas movements, you could be having excess fermentation from the gut microbiome. So foods could be traveling too fast through the small intestine. You might not be able to digest some of those food parts if it's moving too quick, so that there's more there. Or it could be like you're having a really high fiber diet that's rapidly increasing your fiber intake. It could be related to constipation. If food's moving too slowly through the gut, then those microbiota are going to have more time to ferment all of that wonderful food for you. And it could be small intestinal bacteria overgrowth. So small intestinal bacteria overgrowth is having a lot of bacteria travel from your large intestine, where they're supposed to live, into your small intestine, into that last part. And then suddenly they have more access to all of those nutrients. So you're having more gas because of that. Odor issues, it could be it's usually more so because bacteria are breaking down sulfur containing compounds. 99% of the gas produced doesn't have smell. Hydrogen, methane, and carbon dioxide are the 3 different compounds that are usually broken down. That smell comes from the sulfur containing compounds. So specifically amino acids, cysteine, methionine, taurine. So basically your meat sources tend to be higher in those sulfur containing compounds. It could also be cruciferous vegetables. So broccoli, cauliflower, cabbage, kale, Brussels sprouts, other vegetables. It could be garlic, onion, leeks, chives. Some beers and wines can have some of that sulfur containing compound. And there's health benefits to each of these foods. So it's good to have them, but increasing your fiber intake can help. Sorry. Because it's giving, with more fiber, there's more for the bacteria to kind of work on digesting, so that's not going to have a smell, so that you're not having as much of an issue. So treatment, manage constipation first if there is any present, making sure you're getting plenty of fluids. If there is an intolerance, we need to treat that, but limit any polyols. If there's not an effect from limiting the polyols, like your sorbitol, xylitol, mannitol, try cutting back on high FODMAP foods, so those fermentable foods. And if there is incontinence, try the pelvic floor exercises as well. Supplements, try one at a time, some probiotics, some peppermint oils. So looking back at, just touching again real quick on small intestinal bacteria overgrowth. So you have that increase of microbes in the small intestine. A lot of symptoms for people tend to be pain, bloating, excess gas, and diarrhea. It's thought that it might overlap or account for a subset of irritable bowel syndrome. Irritable bowel syndrome is going to cover a lot of different things. So we're covering it towards the end just to kind of be a catch-all. The problem with small intestinal bacteria overgrowth is there's not a consistent definition of what's considered high levels of these microbiomes in the small intestine, because we don't know what's normal. What is the normal amount? So it's really difficult to test for it because there's not really those definitions. You can use breath tests to diagnose, but there's a lot of limitations and kind of inconsistencies with them. Likely treatments is going to be going to that IBS diet anyways. Antibiotics can be prescribed as well, hydrolyzed guar gum fiber, and then maybe some probiotics as well. So getting into IBS, let me know if you cannot hear my computer.
Medically diagnosed irritable bowel
Can you hear it now?
known as IBS, is difficult to treat
Yes.
and overcome, in part because we still don't understand its precise cause. However, researchers at Monash University have been studying the dietary factors in food that can trigger IBS symptoms. This research has shown that the pain, discomfort, and daily disruption caused by IBS is triggered by certain types of carbohydrates in food called FODMAPs. Here we can see some examples of high FODMAP foods. To understand how some foods contribute to IBS symptoms, we need to look inside the intestines, where food is broken down and absorbed. Zooming in to the molecular surface of the intestinal cells, we see they are covered in molecular machines that accelerate the breakdown of carbohydrates. Most carbohydrates, once broken down, can be absorbed through pumps on the surface of your cells. However, some carbohydrates are not digested or absorbed by people. The rapidly fermentable short-chain carbohydrates that can't be absorbed are called FODMAPs. The presence of FODMAPs causes water to be dragged into the small intestine. Also, because they aren't absorbed, FODMAPs travel through your gut to the large intestine. When bacteria in your large intestine get access to FODMAPs, they use them for energy to survive. The bacteria rapidly ferment FODMAPs and produce gas as a result. Excess gas production and water retention causes the intestines to expand. When the intestinal wall stretches from distension, the highly connected nerves around the intestines send signals to the brain. People with IBS have very sensitive intestines, so these signals contribute to the pain they experience. To reduce FODMAP intake and to alleviate the distension, bloating and other symptoms of IBS, Monash University have developed the low FODMAP diet. People with medically diagnosed IBS should consult a dietitian about trialling the diet. The Monash University Low FODMAP Diet app has been developed as a tool to help people with IBS manage their diet and alleviate symptoms. Contact Monash University or visit the website to find out more about the low FODMAP diet.
So hopefully you all could hear that. All right, perfect. All right, so with IBS, like that video is talking about, you have that exaggerated gut response to different hormones, foods and drinks, and medications. And often these symptoms get worse if you have poor sleep, if you're stressed out, or after you're eating or drinking. Um, Causes, a lot of times it can happen after you've had like an acute gut infection. So if you've had a bout of gastritis or like an ulcer or something happened, traveler's diarrhea or food poisoning, it increases your likelihood for IBS. It's not a lifetime kind of condition. A lot of times it can be, but it is a longer term condition. You're more likely to have IBS with a history of anxiety, depression, trauma, chronic stress. There might be a genetic component. Not entirely sure with that, but um, so different questions to ask yourself if you have IBS. Do you have recurrent stomach problems or stomach pain at least once per day? Is that pain associated with two or more of the following? Pooping, change in frequency of your poop, or a change in appearance of your poop? Do you have persistent and chronic symptoms? Are you having recurrent daily pain and pain with bowel movements for at least 3 months? If has your symptoms started at least 6 months ago? This makes it more likely that what you're having is an issue with IBS. No guarantee, but more of an issue. IBS's treatment is that low FODMAP diet. So there's steps. You restrict, you reintroduce, and then you specify it to you. It's a very restrictive diet. We do want to reintroduce those foods because multiple reasons. It's difficult to follow completely. You want to identify those specific things that are challenging for you because you don't want to restrict those different nutrients. This can change over time too. You might, a lot of times if you cut those things out, it's kind of like a rug burn. If you stop rubbing it, it allows it to heal. If you stop irritating it, it allows that gut enough time to heal and be able to tolerate those types of food again. Some of the foods are also on this diet, like we talked about earlier with the microbiota. They love oligosaccharides. They love disaccharides. They're really important prebiotics. They're great for our gut microbiome. They're great for our health. So if we can eat them, it's important that we do eat them and reintroduce them if we can. If they're causing problems, that's a whole different issue. So our FODMAPs are going to be oligosaccharides, which is going to include GOS and fructans. Fructans tends to a lot of times be in like fruits and things like that. We'll see that. Fructose and excess of glucose. So example, honey is pretty much equivalent glucose to fructose. Fruits have a lot of fructose in them, a lot of fruits. And so if you have more fructose than you do glucose, that can cause issues for people. It's just that ratio. Lactose, so milk, common one for a lot of people is that milk. Polyols, these are going to be sorbitol, mannitol, xylitol is another one, not on there, but factors that are going to influence it. It could be the type of FODMAP consumed, so one of those different types that you had. It could be the amount, so kind of like medication has a specific dose to be effective to lower your blood pressure, lower your blood sugars. The amount of FODMAP consumed is going to have a negative effect on you. If you have a little bit, you might be all right. How often you have it. If you have it more frequently throughout the day, you might have more of an issue. If you have it once in a while, you might be okay. It just kind of depends on the person. And then if you combine certain FODMAPs, you might be okay with one of them in one sitting, but if you combine them together, that could be a problem. So those are different things that can influence it. It's very independent, dependent upon the person. And it's not like you're going to have negative effects if you don't follow this perfectly. It is completely based off of what helps with your symptoms. Examples for oligosaccharides, it's wheat, rye, onion, garlic, other specific types of fruits and vegetables, added prebiotics, legumes like your kidney beans. Disaccharides, which includes those lactose and dairy products. I can't talk. Excess fructose is specific fruits, juices, honey, high fructose corn syrup, some flavored waters. Polyols, specific fruits and vegetables, some low-calorie sweeteners, particularly sugar-free gums, mints, low-calorie products. A lot of times it's used as sugar substitutes for sugar-free things. So moving on to our next topic, leaky gut. Leaky gut is basically when those tight junctions of your cells open up and allow more of bacteria and things to come through, creates more inflammation. This condition is a little bit different than the rest because again, it's like SIBO in that it's very difficult to measure. You can drink different types of sugar and measure the sugar concentrations in the urine over several hours. Some of those sugars are going to be too large to actually get across the normal gut barrier wall. So if you find them in the urine, the gut's letting them through when it shouldn't be. Otherwise, you wouldn't see it in your urine. But leaky gut, it can change from day to day. It's not consistent. Like your gut's leakiness can change throughout the day. It's important to know what the benefit is in measuring it because what are you trying to get out of that information? Leaky gut alone is not enough to diagnose a specific disease. It's not a diagnosis in itself. A lot of times it's the result of something else going on. There's not really a treatment for leaky gut because it's difficult to, it's not a thing in itself. It's more like a symptom. So there's not anything to really help manage the symptoms. Stress can impact it. Exercise, if you just exercise, that's going to impact it. High fat foods are going to impact your gut's leakiness, a high fat meal. So it can change throughout the day. But it's not really been known to have any like super negative impact long term, except for like celiac disease. There are some polyphenols and like those plant-based chemicals in plants and short chain fatty acids that are known to help support those tight junctions in animal studies, not yet in people studies. So more to come on that, but we'll keep learning as we go. Um, but along with that, also high fiber diet's been known to help support gut health. So here's your mucus layer that we talked about earlier. Low fiber diets, you see that degradation in that mucus layer and these leaky gut, these blunted cells, more likely to have bacteria go through. One of the big treatments, one of the big things to help improve gut health and gut resistance, decrease that leakiness, is a high fiber diet. And then food allergies and intolerances, last but not least. Allergies involve the immune system, specifically with an IgE response. There's a lot of other antibody tests with IgG. We'll talk about those, not as effective of tests. Allergies affect 1 to 2% of adults, but it needs to be diagnosed by a clinician. Food proteins can be mistakenly tagged as harmful with the allergy, triggering the body's defense system, and the symptoms are usually more severe, get difficulty breathing, racing heart, skin rashes, other digestive issues. Most common ones, cow's milk, egg, wheat, soy, nuts, seeds, and fish. And this is not to be confused with oral allergy symptom. So oral allergy symptom, it's more likely to happen in those who have hay fever, but it's mistaking that food protein for pollen proteins and having that allergic response. So it's not necessarily food itself. It's more like if it's been pollinated and it's sensing that pollen in the food. So you can get mild itching, tingling, swelling of the tongue and or lips, but this is not life-threatening. And a lot of people don't even know they have it. Usually, if you are having symptoms, they can be relieved with antihistamines like Benadryl. Most likely related to apples, kiwi, peaches, plums, carrots, Brazil nuts, walnuts, strawberries, hazelnuts, almonds. These are the more likely ones to cause oral allergy symptom if you're having issues with it. Again, if you get hay fever, you're more likely to have oral allergy symptom, but it's not really, it's kind of an allergic response, but it's related to the pollen. And then food intolerances impact 20% of adults. Again, not life-threatening, but you can get symptoms in the skin, airways, muscles and joints, headaches, fatigue, and gut symptoms. Part of the treatment for this is also countering how you feel about certain foods and avoiding unnecessary restrictions. So if you're anticipating a response to a certain food, you might have a reaction. That gut-brain axis is still going to be at work. So starting, you record the amount of foods you have. Again, it's typically dose dependent, just like IBS. You will see a lot of similar things in relation to IBS with this for intolerances. You want to record the amount, timing, size of meal, stress levels. That's going to impact it. And then common culprits, lactose, wheat, gluten, excess fructose, histamine intolerance is one. And then sulfites and caffeine. Histamine intolerances, they mimic the allergic reaction. You want to rule out allergies first. Foods high in histamine include aged and fermented foods and drinks. So like cheese, sauerkraut, alcohol, cured meats, most fish, smoked and canned fish as well. And then some fruits, oranges, bananas, some vegetables, spinach, legumes, and fava beans. Sulfite is used as a preservative for dried fruit, and it's naturally fermented in grape products, wine, and vinegar. Symptoms are not specific for sulfites as much. People with asthma are more likely to have issues with sulfites. And then caffeine, usually we are able to tolerate about 400 milligrams per day. Some people have more sensitive issues to caffeine, so something to kind of keep in mind. If you are somebody who gets more nervous, anxious, has issues sleeping, or gut symptoms, you might kind of consider that too. Also, think about your exercise. Exercise is going to impact your gut, bowel habits, stressors, emotions, gut symptoms, and your sleep. And then you record and reintroduce. Record, restrict, reintroduce. So again, restrict any foods that you think might be causing problems. Reintroduce, if you can have somebody reintroduce it blindly to you to make sure it's the problem so that you don't know. That would be better off trying to start slow too. So if you have issues with milk, maybe try a quarter cup of milk first, and then the next day try the placebo. So whatever you're using instead, maybe almond milk. The next day, try a third cup in a tablespoon, and then the next day, lower it even more. So you can kind of see what your threshold is. Again, it's going to be dose dependent. You don't want to unnecessarily over restrict if you have to, unless you have to. Complete restriction may increase your sensitivity and lower how well you're able to tolerate it down the long run. Again, some of these foods are really important to your gut. So it's good to not restrict too much. And sometimes if you restrict too much, it can lead to binge later on and cause problems. So really long presentation today, but thanks for hanging in. I'm seeing I'm over here, but there are several things that can impact stomach pain. Check in with your provider. Recommendations are going to be based off what you have. Rule out whatever issues, especially structural issues. Biggest prevention of major issues is early detection. And recommendations can change based off of what you have. Fiber can help, but it can also hurt. A lot of times it's going to help. Again, we talked about structural issues the first time, today's functional issues. Here's some of the sources. Any questions? Stop sharing.